mangithatha i-PrEP ngizongena because of I'm protected HIV, you understand? How do I tell my mom? How do I tell my dad? Kuthi kahle kahle mina I'm into men.
At the end of the day, we really need to accept them and understand that we live with them in our communities.
Exactly.
Sometimes I just feel like even taking my life because I cannot freely be myself.
Yeah.
And hi, everyone. Oh, we are back again. We just like to welcome you, the viewers. We'd like to thank you for this wonderful time again that we're going to have. Today is going to be a wonderful, wonderful session that we're going to have. But before I go anywhere, I just want to really thank you guys for the love and the support that you have shown to us. And I really appreciate, now and then I just go and see, oh, we're still on 59 views. Okay. But I know that eventually, you guys will make things happen. But thank you so much for the love. And also thank you for your comments. Thank you for your views on our first episode. I really appreciate. And I see that you guys really love that episode. It did the things, right? Actually did what I was hoping and more, actually. But I'm really thankful and thank you so much. So I don't want to waste time, guys. As you know, this is Men Speak. We are just about men. We are here to just do the things, the right things, and just help a boy, help a man here and then, and just make sure that we raise our boys well and we really take care of our men. I'm just that woman who is really about our men, and I'm really thankful that we have this opportunity where we can really sit and share, and just love one another. Today I have someone very special, and thank you so much for coming. And guys, just thank you so much for also watching, and I really appreciate. And today, I don't want to waste time. I'm so, when you have that episode and you're like, I can't wait for the day. I can't wait for the day, because this is one topic that is usually not really, really addressed. And I think people, particularly men, are not aware of the information out there. I don't know, at their exposal, go to how actually the information is there. They just need to go and grab it, and really understand who they are and the things that they go through. So today we are just men's health talking. We are just going to be on men's health, and I have, he won't agree with me, but I feel that he's an expert. I feel that he's just one guy that is just doing amazing in Sibiya, just around our area, Val and Gauteng. So he's going to give you exactly what he does and who he is and all of this. So I don't want to waste time, because he needs to unpack, or rather we need to unpack as much as we can. So today we have Isaac in our midst, and I'm a born again Christian, so don't mind the language sometimes, our mist and all that. So today we have Isaac Sibiya, and a health professional. So he's going to really tell us who he is and what he does and what he's about. When somebody marries something, this is the guy. So hello.
Hi, Javelina.
How are you?
I'm good. Yourself?
I'm good. Yeah. Thank you so much for coming.
You're more than welcome.
And I really appreciate your response, your prompt response every time I ask you. And you and I do a lot of work around Val. True. You and I do a lot where boys, mainly are concerned. But I know that it's not you do not only concentrate on the boys, but also on men in general,
True.
right?
Yeah.
Yeah. So thank you so much. And thank you for your love and support. that for Men Speak, and I think you resonate with what we do because you have married this thing. You are
Anything
basically
concerning
this
men,
thing.
yeah.
So please tell our viewers, as I've already introduced you, like what you do and what you are about.
Okay, thank you very much for having me, Jabu. My name is Sibiya, like you've said. I work for Anova Health Institute, particularly based in Sidibing. I'm a men's health project coordinator there. I'm working with men, health for men, taking care of the health of men. Yeah, that's my daily bread. When I wake up in the morning, I'm going to help somebody, some guy there to understand more and better about their health. As you have said, this is the thing that you usually do. We're taking care of the boys, adolescents, men, and the elderly citizens in this country. So we ensure that all men
in this country. I love that.
Yes,
I
we
love that.
ensure that they are well mirroring this health thing, because we know that men, they're not so keen of visiting the facilities, and then most of the time it's about society, it's about how we've been raised, as they always say, monna ke nku ne, alle. Yeah, exactly.
There's no such.
So you want to just shy away from such things, because if they do, men, they have a serious impact when it comes to men visiting the health facilities.
Those sayings, right?
Those
myths.
Those myths around the corners about men. You are a man, you cannot go to the facility, you cannot go to the clinic, all those things. These are the things that we hear on the street from time to time. We are doing the men's dialogue, we are doing the men's event to address such things. We go to schools, you see these young boys and adolescents at schools, they are already married to that particular mindset that they are not supposed to go to health facilities. Hence, today, the country, it has the burden of men losing their life because of they don't want to visit the health facilities.
Yeah. It's a very complex but yet needed conversation for us to have. I know it's going to be a bit tricky because I'm a woman, but this is a platform for men.
Yeah,
this is a woman who just created
to engage everyone
everywhere where we can, and anyhow. So touching on that, I remember. This is the story because we've had him on the show, so at least on the pod, so people will know that I remember that my ex-husband, when he used to take maybe the children for their immunization and all that at the clinic, it was such a shocker, for other women that how, ba batla ha fole.
Yeah.
So, but he said he would say to me, the way that the ideology of a man going to a clinic, it's like into strange, I do not understand why, because you are going there to get helped and to heal and live healthy, So I resonate with what you're saying from what he would tell me, that it was like, why okay I'm sad why, and I would be at work at the time,
They say there's an abuse. I'm abuser.
I feel like really abused, and actually it's just a man taking care of his children, especially the girl. They will like, it would be worse with her, because with a boy they will think, oh, okay, maybe, but with a boy it would be like, okay, it's acceptable, but with a girl it would be like, because he needs to change her diapers and all that, and it would be a strange thing. But I really believe that the narrative is changing and men are really stepping up. Everywhere I don't know whether it's because I'm Men Speak, right? But I open the radio, I read, I go to the net, everything that I do, I just see men lately, and good and bad, So I believe this is why we have such podcasts, this is why we have such spaces to really address those issues.
Exactly, and that's why you have Health for Men, Anova, to address such issues.
Yes.
Thank you very much for bringing up the issue of bringing a child to the clinic. So to address such things, we do have a program called the fatherhood program.
All right.
The fatherhood program, it introduces the fathers to join their partners to the clinic and then have that bonding with their unborn children. You know, how many times, you know, I'm working in the facilities, how many times you see a pregnant woman accompanied by the partner
Yeah.
to the clinic.
The pain of you, a woman, of being a woman, and you see other women, they are supported, and you always rocking alone.
Exactly.
Yeah.
You see, so we are trying to introduce this to the guys out there. You know, if a woman is pregnant, you are both pregnant.
All right.
You need to support. If your woman is pregnant, you need to learn on bonding with your unborn child. And then when you attend the fatherhood program in our clinics, we're going to teach you as a man how to bond with your child, you know, and again, to have that liberty of accessing the healthcare facilities services, you understand?
Yeah.
Because, for instance, a simple thing, HIV testing.
Yo, that one.
That one ke kgokgo.
That one.
That one ke kgokgo when it comes to me.
Safe, you know.
Exactly, you understand.
Yeah.
We as men, we are testing ourselves through our partners.
Yeah.
Or I motho ka ba lo ile wo sida ba mtestile o grant. So le nna ke grant. Doesn't work like that.
Nah.
Each and every person on a status high. You know, we have a serocontent status whereby you can be HIV positive and I become HIV negative. I can be HIV positive, you can be HIV negative. So you might sit with that particular thing at the back of your mind, or your partner is HIV negative, but you have only to find out you are HIV positive. Yes, your partner is negative, but unfortunately you are HIV negative, positive. So that thing, it is a danger for a person to sit with a HIV positive status, not knowing themselves. Hence, today I brought these beats here to demonstrate the importance of HIV testing and also the importance of taking your medication right, you know, because we are facing something, Sis Jabulile, right now. I can say we are testing 100 of men and then they are testing HIV positive. 100 of men.
Sure. All 100.
Yeah. Let's say, for the argument's sake, we're testing 100. 70, they become HIV positive. They are living with HIV. Once we found out that these 70 guys are HIV positive, along the run, we'll remain with 40 or 30 guys. 30 guys, you understand? Coming for treatment, correctly so. Those 30, they will come. Along the way, we left with only 20. We also lost another 10. Where are those people? Where are those gens?
What are they doing?
What are they doing? My concern is that also during this TB campaign that was held in Sibiya, we have learned through our MNE reports that most of men are dying of TB. And then when you look in the Gauteng, Sibiya, it was one of the contributing districts. It was doing well on death, which is very, very, very bad, you know. It's doing well on STIs. You know,
Sibiya. So you mentioning Sibiya because
I am there. It's my area. I'm seeing the numbers from time to time in Sibiya. You know, you understand the numbers that I see. You understand. So for us to understand the virus in our body, because sometimes it's just the thing where a person is fighting with something that you do not see. You know, and remember, when you are HIV positive, Jay, you are not feeling any pain in your body.
Ish.
There's nothing that's going to encourage you to seek help up until it's too late.
Is there a reason why?
Yeah, exactly. You know, so that's another reason. That's why on a later stage we are going to touch base on the prostate cancer, which is another reason.
That is,
you understand? Yeah. Next month is prostate cancer month, by the way. So we are supporting the guys' prostate cancer months and men's international days on September. You understand? So quickly, let's look at the beats, Jay, to make things easier for people to understand. Ne?
Yeah. Are we going to touch base on the states before we go there?
Yeah.
Okay.
Yeah.
Right.
So you see these particular beads,
right?
Ne? They is the symbol of your body. HI virus in your body. You can see we have a red and a black. This is the symbol of your immune system.
Okay.
The red, it means HI virus, and then the black, your immune system.
Okay.
Remember, HI virus is there to attack your body. So during infection, you are like this.
Okay.
HIV is on your body. Ne? And then now you need a treatment to come and rescue you so that your immune system can multiply. Ne? Then we come here. When you start the treatment, your immune system starting to respond to you. Hence, you see now the black color, and then the red now is starting to dissolve or disappear. You understand you are taking your medication, and then you are doing well with your medication, and then you are coming all right. Now, consistently taking your medication correctly, here you are.
Sure.
Your immune system back, and now it's able to fight for your body. It's responding. You know, you are taking your medication accurately. Now, the advantage about this one, Jay, is that when you are on this stage, you are able to not transmit the virus to other people. You is equals to you.
Right.
Undetectable is equals to untransferable.
Sure. Right.
So if the HI virus here, when we test you, obviously, when you take blood, is going to be undetectable. Then you cannot transfer it to your partner. Hence, you see today, we have people who are giving birth to HIV negative children, of which that's what we want. Now, people, when they are here, sometimes they intend to relax, get grand, take a shabu, and then after that, they're no longer taking their medication accurately. That disadvantage about here, when you stop taking your medication, you quickly jump to here.
Sure. Just like that.
Just like that. You move from here to here. You jump that stage.
Literally.
Literally, just like that. But then when you come back and going to take medication again, you start going to that stage and then come into this stage.
Sure.
So that's what's happening in your body with the treatment and HIV. So now you can tell that people who are not coming to the clinics for their medication, not taking their treatment accurately, they are here. So literally, there's nothing that's fight for them in their body. Immune system is gone. HIV virus is dominating their body. Now, that's when you're going to see now sickness. Symptoms, you know, different symptoms. You're losing body, diarrhea, oral thrush. You understand a lot of things that are happening in your body. Even STIs, TB, co-infection, And then the disadvantage about this stage is that it's calling and opening doors for many, many other diseases. And then you are going to have what at the end of the day? Treatment fatigue, HIV, TB, STI, and other non-communicable diseases that can be diagnosed in your body during that particular time. So that's what you want to teach our men. Don't be fooled by people on the street.
Hey.
When you are you are saying you are healed. You are not healed, my brother. HIV virus is still there. That's why you can see the red part there. This red part can be here.
Oh, actually, I didn't see it. Oh, okay.
Yeah, this
so
red
it's
part.
Still there.
It's still there. It's just oppressed. And once it wakes up, remember the duty of the treatment in your body is to fight this. Take this to sleep. Then when this is sleeping, it cannot consume this. So this is able to multiply itself. And then the duty, these are the soldiers that are protecting your body. Then your body can be active and protected again. This one, opening doors for many things. So amajitamela bayazi tideng uti womosekasi, you were once told that you are HIV positive, but awuguli for now.
For now.
You are grand for now. But inside your body, you're like this. And then I usually say, umuhle, was umuhle. Umuhle kudla ngaphakathi. Mase siwisipala, sesithola ukuthi akusana fokol. Kuphelile. So that's why it's also important, whether you know yourself, you don't know yourself, go to the clinic and know yourself.
So by co-infection, what do you mean?
Oh, the dual infection or co-infection is when you are having TB and HIV. These are the friends. If you have TB only, you are likely to have HIV. If you have HIV only, you are likely to have TB. That's why when you are HIV positive or tested positive for HIV, we are giving you the preventives for not catching the TB. If you are getting the TB, we need to know your status for HIV so that we can also prevent you from getting the virus. We know that even people who are testing HIV negative, we want them to remain negative. Hence, we give them PrEP.
I was going there.
Exactly. I know you love it like that. We are giving them the PrEP.
It's because PrEP is like, people have turned it into a solution.
Yeah.
So I don't know whether it is a solution, but used in the wrong way, or, maybe we can
we misuse the opportunity, SSJ. Amajite they're misusing the opportunity to you know what, 30 PrEP. Mang 30 PrEP ngizongena. Because of I'm protected HIV, you understand? Forgetting about the pregnancy, forgetting about my STI. Perhaps, hence, we have a high volume of people who are having STIs, especially when we do the TVETs and the universities. They love PrEP, which is a good thing. They want to prevent themselves, protect themselves from contracting the virus.
Yeah.
But it becomes wrong when you are going to misuse this particular thing. Akona nama time I tata with PrEP. You understand? Akona nama time I tata with PrEP.
Why do I
laugh? And at times about cheli, I'm a partner wa bendlini with the 30 PrEP by fihla, because of bafuna lama pengan lao, and then abafuna condomize. Bayazi ukuthi mangne PrEP, nano mangagula lo mntwana, ngigrand mina.
Sure.
You understand? Forgetting ukuthi lo mntwana lo uzombamba ube ugrand, you will never get HIV, but ungamshiya pregnant. You will never get HIV, but you can get the syphilis. Of which syphilis now is one of the dangerous STIs. We have plenty of the STIs, plenty of the STIs. That's why lang hamba khona hlala ngiphethe ibhokisi, hlala ngiphethe ukuthi educate amajita. Yabona, educate ama-time emakhona. Exactly, I knew ukuthi mangiza la amajita mele ngiwathole. Ngizowathola amajita, ngizowaguide. Akhona amajita ngiwaguide. Gents, there is STI. There is HIV. You understand? Yes. And then, you might find yourself ukuthi you ujabuleli PrEP. You are happy with I'm taking PrEP, and then you are going to have the liberty of ukujwala konke lapho ungena konke, and then after that mawuhleli nje ulandelwa izisu.
Hey, that's
low pregnant. Mawuyithayama yokurotma legacy, you are married. Uthethe STI estradini. Uyilethe endlini.
Loya mama loya uhleli.
Mama uhlelele kamnandi akana stress nawe. Wakhe, and then you are using the advantage. I'm married. I'm not using the condom ila endlini, and then when uyosha ngaphandle wasula umlomo mawufika usi STI kumama.
The disaster, or rather I can call it maybe the pandemic that we have with that scenario of partners, because sometimes it can be a woman. It's not just that it's only men, it's especially also because I'm a church girl, maybe in the church, you think that's the safest space.
Yes. We have sessions with the Abafundis, you understand. The worst things are happening, Sis J. Ngamajita, you understand, and then again we cannot run away from it. We have men who sleep with other men. You understand? Of which
that's our reality.
It's the reality, you understand. But now there's somebody sitting there. How do I tell my mom? How do I tell my dad? I'm into men. My mother is expecting makoti. ba-expect izulu ukuthi zibe khona. Ngizobahlolela mina ngizobatshela ukuthi ngibalathele enye indoda. You understand? So we have that particular nation. The LGBTQI is there.
Yeah, it is.
You understand? But iba buhlungu when it comes to ukuthi their parents now are celebrating other gays, lesbians outside, but now forbidding their own children the freedom of expressing themselves. You know, I won't mention names, but you know, you find out somebody when you are watching TV, and then there is this particular member of the LGBTQI community, and then you'll be saying, "Oh, this guy," you understand? But when is going to be your child? That's number one. Number two, now abantwana abakwazi ukuzi-expressa to their parents because of the comments that the parents they do about the judgment about those particular people. You understand? You know, you calling them names and stuff like that. You understand? And then to find out you have one here.
You know, I have a case in Free State. So this guy, I was invited by these guys who are doing amazingly in Free State, the Y2K, you know, K2K rather, sorry, Kasi, they call themselves
Kasi.
Oh yeah,
I saw the page,
Yes. And they do, those guys, they motivate me to really want to bring that vibe in the Val, you know, on J, wherever I am. So this, after a talk, and then this young chap comes to me and he says, you know, I want to talk to you. You know, I'm like, oh, okay, fine. What is wrong? And he says, I cannot deal with the judgment that I'm facing at school. You know, so you know, at school where I feel I cannot. Sometimes I just feel like even taking my life, because I cannot freely be myself. Yeah. And, you know, funny, today I asked him how he was doing. You know, he told me that he's okay. But you can tell right, because Ufila so much pressured. He couldn't even speak, you know, because he's gay, you know, and they just feel like, you know, the judgment and the hurt and the words and the treatment that I receive, it makes me feel like I don't deserve to be here, you know. And I'm thinking to myself, you know, if this reaches Free State Bantu, I need help for that young man, you know, because it's very bad to. And I'm glad that he actually came and we spoke, you know, and I really tried to encourage him. So because I'm not familiar, Gangago, with that, you know, and also with Free State, so I couldn't connect him to the right people. You know, to the right people. But I felt like he needs attention. You know, it would be sad for me to hear something happened to him when he has reached out, you know. So also it shows that for me, not being able to even find help for him, it means, you know,
exactly,
no facilities are even available to accommodate such people, you know, to say, they're still human, 100%.
Exactly.
We may not understand them, we may not know.
It's not demonic. You
know, they are human beings. At the end of the day, we really need to accept them and understand that we live with them in our communities.
Exactly.
You know, so that we can learn more and understand more. Yeah. And you know, I used to love. I know I might be judged for this, but I used to love Buji's podcast on Meg G. You know, because from that podcast, I really learned a lot about them. I really learned a lot because I got to understand a lot of things that I did not understand, how they feel and what they think. And Labobantu, they are so talented. They are so, and thank you so much for bringing that up. But I'm still shocked about
the beats there.
I'm still, because I'm looking at them and I'm thinking to myself, it's a wow.
So, you know, it's quite interesting when people, and they understand better. Other people, they understand better when they through the vision, you know.
Yes.
If you're telling me, hey, you and then I'm telling you know a fairy tale to somebody. But if I bring it here on the table and then demonstrate what's happening in your body, Now it's going to make sense to that particular person. Who wants to be there?
Yeah, no one
wants to be. We all want to be here.
Yeah, that's right.
Yeah, man. So if you are here,
and people leave, eh?
Oh, Gosiam.
People leave.
I know. We see people, man, waking up
from the gutters,
from the
yeah.
You know, there's only one scenario yang zisubhlungu lapeval ebipatong ne. Sometimes last year, just doing the visit, supporting Amachita facility, you know, ensuring that our gens are getting the proper service in the healthcare facilities. I saw a guy who was brought to the facility in a wheelbarrow.
Right.
Then now I sat for a moment and then they were neighbors. And then I had to ask, what's happening? Then they tell me the story. I mean, says G, unless it's cut, there's still people coming to the facility in wheelbarrow because of HIV.
Then, I hear where you go.
You understand?
Yeah.
Then it showed me, no, man. There's a lot of education that is needed. And then such platforms, it's a good platform to teach people, you know. We did IEC
You're
material.
still going to come back.
Yeah.
I know we're not going to reach a lot of
things because it's really packed, you know. Yeah, some of the topics, they are topics on themselves, you know, stand-alone topics. That's why we just want to incorporate everything so that people, they know there are such things. We do IEC material, you know, wherever I go. Petama Pepa Labo Health for Men, talking about STI, health fact, teaching the guys how to take care of themselves, you know.
Especially the young boys. I love that session where you taught them when they take a bath, what they need. Because sometimes as parents, especially us as women, we like, no, you don't know what to say. You know, you get,
And most of the time we leave boy child behind.
Yeah, we do.
The girls are always up front there. You know, we even go and then lobby for them to get the free pads and everything. We take the girl child to school. We think those girls, who's going to marry them?
Who's going to partner them?
Who's going to partner them?
Who's going to brother them?
Who's going to brother them? Ne? The very same boy, umshaye mover, you took your girl, has a master's, you forgot about the boy. And then the opportunities are shattered for him.
Do you think because I know men speak about just trying to cut off this gap.
Yeah.
You know, do you think we are getting there?
We are getting there. We are here. Yeah. That's why each and every day I make sure that I engage you. You know, like this particular thing I told you. No, man. You know what? Like for instance, I'm in a health professional, ne?
Hey, that one also, yeah.
You understand?
Yeah.
I'm in a health professional, and then it'll be like, in the program Health for Men, we want to make it a safer space for men to discuss their challenges, you know, to be free. A safe space for them without being judged, you know. Indoda ikhululeka mayikhuluma nenye indoda most of the time.
No, it is like that.
You understand.
I work with men. Trust me.
Exactly.
I've been working with men. I know.
Every event, every dialogue, every clinic. Ngaba se clinic ne ngikhulume nabantu mangiphuma. Immediately mangiphuma. One person uzongistoppa. Maphuma kungena omunye. You understand? They feel safe talking to a man to man. We really so wished. Now, Mr. Beloved, which you know, our health for men clinics, babe nama clinician or madoda.
Yeah,
it's a struggle to get one.
Yo. Which brings us to that other point of us. I don't know whether I must just best the thing a bit,
exactly,
you know, the bubble that we need to take a boy child to work.
Take a boy child to work.
Because I know you always tell me, Jab, we are struggling about maleness.
Exactly.
We need, you know, I was on Insta the other day and I saw this guy, he's a maleness, and I said, you know, I'm trying to reach out to him to say, you know, come and tell us about this, you know, because I realized that we really, really need to have that kind of people coming to speak, and what can you say more about the men's health? Maleness, because we really need them.
Yeah, I would say we still need to teach the guys, more especially about matric. This is not a CC profession.
Hey man. And why do we even use that name?
Exactly. They feel like,
Yeah.
I also, most of the time when I told people previously saying in the clinic, like maleness, you understand such things. No, man. It's more like window to wash izitsha. Window to a cleaner. Who said that I was clean?
Yeah.
Who said that I was pega? I was washer.
I love what Omo is doing. You have seen this,
exactly.
right?
I've seen Omo Tatamajita, talking about real things.
Issues that are really affecting men.
Because of more that Omo wash. So we need to bring them on board and say mobilize the career of nursing to the gents. Masinga nursing college kona manje uthola bosisa bengaki majita engaki. Masinga clinic. Exactly. Masinga clinic. So uthola our programs that's warana ima facilities funa majita. We want the male nurses. Only one male nurse packed with work. Can't even, maneuver around and collaborate with other programs. Although they want, they can't, but it becomes a burden to them. You go to other facilities, more of them, they don't have male nurses.
Sure, we're going to touch on this, but because now we need to wrap up. Let us just quickly go through quickly on the prostate cancer. I always pot.
Yeah, I know. Even last
just
time,
a bit.
Last time we in radio,
yeah.
Prostate cancer is one of the important illness or prostate cancer that men are experiencing, and it's a robust illness.
So it's a cancer that affect
only male, because it's only males that have the prostate. The prostate cancer, it doesn't have symptoms at an early stage when it presenting themselves. As I told you earlier, with the challenge of not feeling any pain. When it starts, that's why we encourage men, especially if you are an African male at the age of 40. Go to the clinic now. We are back live. We remember we have a challenge about our laboratories. We are back now. We can be able to smoothly assist our men in our facilities to test for screen for PSA, so that they can tell at an early stage if they do have prostate or they don't have. Because of it's very much advisable to find it at an early stage. Now, if it's in a late stage, if you are a man, you will find it. You will find the symptoms when you are urinating. Is no longer coming out likewise. You need to push and push and push because of now the prostate cancer, the prostate gland now it's bruised, and then when it's bruised, then it's squeezing the urethra, and then the urine cannot pass smoothly like that. And then if you know that when you are urinating, your urine was reaching there, and then you're here. You need to consult. If you have pains on your testicles and you are finding discomfort, around the manhood, run to the clinic. We have equipped our healthcare professionals on how to deal with men, on how to welcome men, how to make men feel at home when they come to the facility. They know about these things that we are talking about. Just tell them that you are here to just screen for PSA, because of now. At times it is a struggle for men to come to the clinics. You understand, to find themselves screening for free of charge. You understand, and this thing is particularly dangerous when you're going to find it on a later stage whereby there's nothing that can be done.
Mr. Sibiya, you definitely need to come back. Definitely need to come back, and thank you so much for this time. We really appreciate your time. Thank you also to Health for Men, ANOVA, thank you so much. And I want to say you are doing exceptional well. You inspire me,
Thank you.
to do better and to love men more, embrace men more, and know that awugcina ndoda.
Yeah, gcina ndoda.
Madoda.
Ndoda,
Yeah, thank you so much for the beautiful and amazing work you do with the team and with the facility and with the institution. We really appreciate you. We need more institutions like what you guys are doing. We really appreciate. And lapha emakhaya siyabonga. Thank you so much for tuning in. Thank you for taking time. He's definitely going to come back, and we really appreciate this time. And again, I just want to give a shout out to AMP Studios, and thank you so much for the lovely and the amazing work that is done here, for the opportunity that we get, the opportunity that, we travel all the way to get, but it's really appreciated to know that there is such a place that we can come and really make sure that konke kuyenzeka. Thank you so much. And guys, please keep on subscribing, liking and sharing and showing us love there. Thank you so much. If you have any topic that you think we can discuss, you can drop us on the comments there, and we'll definitely look at it. Thank you so much. And I really appreciate all of you, and thank you for the love. Thank you so much. Till next time. Thank you.
Shab, shab.